And I'm Andrea.
And this is GNA for today.
And we are two best friends living a faith-based lifestyle.
And then we're documenting it.
If you're new here, welcome, welcome, welcome. We'd love it if you would hit that red subscribe button down below so you can stay in touch with us with our videos to come.
So last week was a day in my life in quarantine. That was a very fun video to make for you guys, and we had a long chat and I was very excited about it. So if you haven't already seen it, make sure that at the end of this video that you go watch it. We'll link it in the tab. I never can remember, is it this way or this way? I don't know, but it'll be up there somewhere so that you guys can watch that.
This week's video is a little more of a serious topic, more serious than we have been doing the past couple weeks. It is about why going to therapy is okay. So if you want to learn more about that, then keep watching. The first thing that we wanted to talk about is just a few disclaimers and a few ways that we want to destigmatize the idea of going to therapy. So the first thing that we wanted to say is the fact that if you have a mental illness, it does not mean that you are not tight with God right now. It does not mean that you're not praying enough. It does not mean that God's getting back at you. It does not mean what a lot of Christians are telling you that it means. And if you are going to therapy and you don't have a mental illness, that shouldn't be seen as a bad thing. It doesn't mean that you, just like what I said before, it doesn't mean that you're not tight with God. It doesn't mean that you're not praying enough. It just means that you need some professional help.
So I wanted to talk about this idea of destigmatizing therapy, right? So sometimes I get this question about, well, if you have mental illnesses, like God can heal you, right? You're a believer, like just pray and it'll be healed. Yeah, God has the ability to do that. He's God, and He works that way, and sometimes that happens. But sometimes healing needs our involvement, and sometimes getting better and improving means going to therapy. It means listening to what God is leading you to do, because maybe something that is in therapy is something that is going to teach you how to better deal with things that are going to happen later on in your life, and that moment of you going to therapy, or that length of time that you go to therapy, or whatever, like that is what God can use. So just because God has the ability to heal doesn't mean that that's in His will for us. And I mean that in every scenario, right? Like not just in therapy, but you know, with, for example, myself, I had a heart transplant and I'm so grateful and so blessed, but I went a long time without being healed, you know, and I'm not healed. I got a new heart and that's amazing, but I still have trials and tribulations. I still have the ability to go into rejection, and I get sick easier, and I'm immunosuppressed, and blah, 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 blah. So just because, you know, God has the ability to instantly send down a healing over us, it doesn't always mean that it's in His will, but we have to trust that what God is leading us to do is in His will and is in our best interest, because I mean, God sees all of time, right? So He's not going to send us down a path that's not going to lead us towards the end goal. He's just not going to do that. And so it doesn't matter if you have a mental illness that needs treatment. It's okay. I have a mental illness and I seek treatment for that, so it's okay.
So there are multiple reasons to go to therapy. You don't just go if you have a mental illness. There's so many different reasons why you could go. You could go to counseling for grief therapy. You could go because you're going through a hard breakup. You can go for, some people might consider marriage counseling a form of therapy. There's so many different areas of therapy, and it's not just for people who have a mental illness. It's just for people who live life and are normal people.
So the next thing that I wanted to talk about was sometimes it's better to seek help before you need it so that you are prepared for when you need it. And I'm talking specifically about a type of counseling. This would be more related to couples generally, or to maybe someone who, like myself, mental illness runs very heavily in my family. So depression and anxiety has a long train in both sides of my family, and both of my parents have major depressive disorder, and my mother has generalized anxiety disorder as well. So me knowing that, I went and sought out help before I actually needed it. So I went to therapy for a couple of years, not really needing counseling, but I went because I knew that I was already predisposed to these conditions, right? And so I knew that I would need all of the help that I could get, so that if these conditions were a permanent thing in my being, then I would have the tools necessary to combat it, if that makes sense. I generally recommend married couples, people dating, people who are engaged, like if you're in a serious relationship, that you go to couples counseling, you go to marital counseling, even when things are good, like from the very beginning. And I always suggest this because there is power in open communication, and you feel heard that way. And so that can avoid a lot of arguments and things within new marriages, wedding planning, etc., etc. So I always recommend that. But I mean, if you know that, like, say maybe you're 15, 16 and you know that your family has a history of depression or bipolar disorder or dissociative identity disorder or whatever, you know, like any type of mental illness, then go see a therapist, go see a counselor and be like, hey, I'm predisposed to this condition, and they'll diagnose you. Like, they're gonna take a full exam of you, and so go and get that done, and just so that you know, so that you have contacts in your area, right? So if you are prone to needing one-on-one therapy or whatever, that you have phone numbers to call when you need them, so that you're already equipped and prepared for the battle before entering it. So we wanted to provide you guys with most of the different types of therapies that we could think of that are the most readily available. The first one I wanted to talk about is psychiatry. So a psychiatrist is a licensed physician in mental illness, okay? Generally, they are going to be the ones that prescribe medications. Psychiatrists do also do counseling. Some places don't, so you'll need to check that out in your location first and see kind of what that looks like for you. But on a general scale, psychiatrists will do therapy and counseling with prescribed medication. So they will be the ones prescribe you antidepressants, you know, mood stabilizers, etc., etc. So that is specific to a psychiatrist. Medication, psychiatrist. Psychiatrist to medication.
Another type of therapy is the most common one. What we think of whenever we think of the word therapy is just one-on-one therapy, which is just you talking it out with your therapist or your psychiatrist or your psychologist. But we did want to say that a psychiatrist is the one that can prescribe medication. Your normal run-of-the-mill therapist does not prescribe medication. That's not what they're there for. That's what psychiatrists are there for.
The next type of therapy is called combination therapy, and this is the type of therapy that I receive. It's the best kind for me personally. It doesn't always work for everyone, but basically combination therapy is meeting with a psychiatrist who will provide you the medication, but also meeting with a general counselor. Combination therapy can go a million different types of ways. Generally, combination therapy will be a psychiatrist plus someone else. If there's multiple ways to do combination therapy, you can have 3 sets of therapy, you can have 4, you can have 2. It just, as many as is needed to provide security and comfort, that is what you need. So combination therapy for me looks like a psychiatrist who prescribes me medication for MDD and GAD. I'll have those little pop-ups on the screen. So he provides me one medication for an MDD and a medication for GAD, and then I see a licensed psychologist, and I meet with her once a month, and we talk about all the things that have gone on. We talk about how my mood has been, if I need to, you know, if my medication feels like it's working for me, etc., etc. So generally speaking, it is best with combination therapy that you stay within the same practice, or that if you are using a psychiatrist, that you let the psychiatrist refer you out to your psychologist or to a group therapy or whatever, because that way your psychiatrist and your extra therapist or your extra group therapy, whatever, will have constant communication. So my therapist and my So my therapist and my psychiatrist are in constant communication. So if I were to go to a therapy session and I just like completely blew up, and you know, my therapist feels that it would be best for me anxiety wise to up my dose or to change medications, she would call my psychiatrist and she would say, hey, I just saw Grace Ann, this is what happened during our session, this is what I think, what do you think? And then my psychiatrist will say, yeah, I agree, or I don't agree, and blah, 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 blah. And then the next time I see my psychiatrist, he'll bring up the fact that he had spoken to my therapist, and then we will discuss what happened, discuss how I'm feeling, discuss what my medication is doing, and then we will decide what to do from there. So that's just kind of a basic idea of combination therapy. Not everyone needs combination therapy, but it is probably the most common, and it works for me. I'm all about some combination therapy.
And then the next form of therapy, which is normally the last form of therapy, once you've gone through one-on-one therapy, your therapist could say, okay, I think you're ready for this next step, which is group therapy. And that's just whenever you are just talking it out with a group of people who are going through some things just like you're going through, just to let you know that you're not alone. So a lot of times that comes after the one-on-one therapy.
So one thing that I wanted to bring up is the idea of therapy versus medication. So this debate has gone on for forever, and I mean forever. So here's our honest opinion, and Andrea and I we've had lots of discussions about this actually. We had one very specific discussion when we were planning this video, and we talked about how exactly we both felt, etc. So sometimes in any case, you could be fine with just talk therapy. So you, for example, could need some type of therapy, right? Let's just say let's make up like a character. Okay, so we're gonna say Bob. Okay, this is Bob. Bob is in my hand. Okay, so Bob, sometimes he gets really anxious and he gets nervous, but it's usually only when he's around people. Okay, when he's at home, he's completely fine, and he doesn't worry about anything, and he's able to function on his own. When he's at work, he's okay because he's already met these people. He's made himself comfortable in this environment, right? But Bob is now getting a promotion at work, which means he'll have to travel more, and that makes him scared, because whenever he's out with new people, he gets very anxious. Okay? So if I'm Bob, my idea is, okay, I need to figure out how to take care of my problem before I accept my promotion. He's gonna call his behavioral health office that's closest to him, and he's gonna say, hi, I think I have social anxiety, could I be matched with a therapist? They're gonna ask him like a couple of basic questions: where he lives, what he does, how old he is, etc. If he has insurance, blah, 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 blah. And then they'll say, okay, with your insurance, this is how much it's going to cost for you to receive talk therapy. Would you like to make an appointment? And he's like, sure, that's fine. And he makes an appointment, and then now he is going to this appointment, and he sits down with a very lovely therapist. They get along great. They have a lot of the same interests. He feels like the therapist really understands him and really listens to what he's saying and provides good feedback. So Bob is now very comfortable with his therapist, and after talking it over, they have found some simple solutions that Bob can do when he's in social situations to calm himself down if he reaches a point where he is too anxious to function, right? So his therapist has said, okay, all right, Bob, okay, so he's gone and seen this therapist, right? He's completely comfortable with the therapist. He loves talking to them and saying anything. At the end of the appointment, we'll say, okay, this is what I diagnosed you with. Let's problem solve. So they set up another appointment. He goes back in. He accepts the promotion, but he knows that he's got like 3 weeks to go. So he's, the therapist fits him into their schedule. He goes, meets with them, and they find all of these solutions that he can do, right? They talk about simple grounding, or they talk about how to pull yourself down with a breathing method, etc., etc. So when Bob goes back into work and has to go travel and meets new people in this situation, if he feels himself getting anxious, he's going to use the techniques that he learned in therapy. And it works great. And Bob lives a happy life. Some people are like Bob, and they only need talk therapy because the solutions that are provided in talk therapy are completely fine for them. And they help and they work, and that's wonderful. Now, some people only need medication. Some people are like Sally. Okay, we're gonna say that this is Sally. So if Sally, let's say most of the time Sally can't get out of bed, right? She just feels kind of down. She doesn't know why. Nothing major has happened recently. She's just caught up in the mundane of life, she thinks, right? But then, things start to deepen, and she starts to realize, oh, my mom said that she has depression. I'm gonna ask her what that means and what that looks like for her. So Sally has a conversation with her mom, and her mom says, yeah, Sally, that sounds exactly like what happened to me when I got diagnosed. Here, why don't you go see the psychiatrist? Find a psychiatrist in your town. So Sally calls her local behavioral health office. They match her with a psychiatrist and her insurance and blah, 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 blah. And then she goes and she meets her psychiatrist. Her psychiatrist conducts an analysis with her and then decides that she has major depressive disorder, but that's fine. She can receive XYZ medication, and the psychiatrist writes the prescription, hands it to Sally, tells Sally to go and come back in 3 weeks. Okay, so then Sally goes, she takes her medication as prescribed, but after 3 weeks or so, she notices that it's easier to get out of bed, it's easier to make her bed, it's easier to brush her teeth in the morning, it's easier to remember to do breakfast before she leaves. Simple tasks are getting easier for her. So then she meets with her psychiatrist again for a follow-up. He says, look, I think this medicine's doing wonderful for you. Why don't we keep it at this dose, and then you'll come back and see me in a month or whatever, right? So that works for Sally. She doesn't need to talk to someone because it's just a wire thing in her brain, right? She just needs some medication to even out all the stuff that's in her brain. And that whatever medicine worked for her, and she's fine. But then there are some people, like myself, who need combination therapy, right? They need someone to talk to, but they also need the medication, because talking doesn't always feel sufficient for me. But sometimes medication is not sufficient. But when you put the two together, it is completely sufficient, and I'm able to live a normal life, right? I'm able to do the things that I want to do and the things that I have to do.
We also wanted to mention that medication is not an instant fix. Just because you've been taking medication for a week doesn't mean that you're gonna be fine. Like, it takes a while, and that's okay. You should expect that. You shouldn't expect to just go a short amount of time and be completely cured of your mental illness or anything that you're taking medication for. It takes a little bit of time for it to get in your bloodstream and for your body to get used to it.
Another tip along this line is that therapy should always feel comfortable. So just like it takes some time for medication to work, sometimes it takes time for therapy to work. And sometimes it takes time for you to find the right therapist. Simple things can affect this. My very first therapist was someone who was completely opposite of me, but I loved her. I thought she was amazing. She was this African woman who had come over to study in the States. She was from Nigeria. She was beautiful. And she was incredible. She was only like 3 or 4 years older than me, but we got along so well and we hit it off instantly. She instantly knew what I needed, and we clicked. We worked really well together. Well, after she had finished schooling, she had accepted a job somewhere else, so she wasn't in my office anymore. Well, I tried to stay in that office and switch to another therapist who was similar to her, but this therapist felt too much like my mom, and it just wasn't comfortable for me, so I switched to another therapist. But that therapist was a male, and I personally am not comfortable with that. That wasn't a comfortable situation for me, so I removed myself from that practice, switched to another local practice, and I met an amazing psychologist and an amazing therapist who I love, and now I'm like receiving some of the best therapy that I could have ever had, and because I'm comfortable and I'm being real and honest. So if a therapist makes you uncomfortable, don't be afraid to come out and say, you know, this therapy session wasn't the most comfortable for me. And they'll be like, okay, why? And then you'll tell them, and then they'll find you another therapist, right? So if you have to go from this practice to this practice, or from this therapist to this therapist, don't feel like it's your fault or anything. Therapy should feel 100% comfortable.
We wanted to talk about the difference between professional help and your friends and your family. So, yes, professional help is so great. Yes, having friends and family is so great. But it is important to know that your friends and family don't replace professional help. Like, if you need someone to talk to, yeah, totally go and talk to your friends about what you're learning in therapy, or if you're not going to therapy, just talk to your friends in general. Just because you're talking with your friends, it doesn't mean that they have the knowledge or the education that a professional does to actually help you with your problems. Yeah, it will help for a short amount of time to just talk them out, but more common than not, it's better to have a professional to talk to as well as your friends. It's best to have both instead of just one or the other.
So this is editing Grace and realizing that I completely forgot to film my thoughts on this section. But on the note of professional help versus your friends and family, it's not your friends and family's responsibility to take care of your mental health. And I know that sounds harsh, but it's true. If you are struggling with your mental health, it is your responsibility to seek help and to seek the help that is sufficient for your needs.
Professional help is unbiased help. If you're talking with your friends about some situation with Johnny Sue, they're gonna be like, oh, Johnny Sue did this to me in the 7th grade and he was so mean, so that's why this situation should go this way. If you talk to your therapist about Johnny Sue, they're not gonna know anything except for what you tell them. So that's just a really good pro in the situation of getting professional help, is that it's an unbiased opinion and they're not going to be putting their prior misconceptions or anything about your story or other people's story, because they don't really know anything but what you are telling them.
A lot of you are like, well, this is a good video, but Corona. Okay. There's a thing called telemedicine visits. Most places have them now because they have been forced to learn how to do them. So, for example, my psychiatrist and I have an appointment within like 2 weeks over telemedicine. So all I do is I go online to the online portal, I sign in, and then there will be like a little check-in button, and that's your receptionist. And you check in, you put your name down, you pay your copay or whatever over the computer. Then you sit in this virtual waiting room, and you sit in the waiting room and you wait for your doctor to see that you're in the waiting room and then click on you, and then you'll pop up on their screen and they'll pop up on your screen, and you can have a one-on-one visit with your psychiatrist or your therapist or whatever via computer screen. So you don't have to leave your house, you don't have to risk getting corona or anything. A lot of places are doing this, so if it's your first time looking for therapy, call and see, and just say, hey, do you have a telemedicine option? And if they say yes, great, then be matched with someone. If you're already at a practice, call them and say, hey, is there any way we could do a telemedicine visit? Is there any way that we could do, Zoom or over the phone or whatever? You need to be careful and take care of yourself during this pandemic.
During this weird coronavirus time, there are so many different offices and practices that are offering over the phone help. Even if it's just your normal like family doctor for a checkup, they'll still be doing, a lot of them will still be doing like FaceTime doctor visits or phone call doctor visits. So don't think that you need to wait to get professional help. If you're really feeling the conviction and the need on your heart to get some professional help, you don't have to wait because it's accessible to you right now. Thank you guys so much for watching. We hope you enjoyed this video. So leave a comment below what you thought about this video and if you have any more thoughts to put on the table.
Thanks again for watching, guys. Make sure you hit that like button down below because it helps us out so much. Make sure that you subscribe to our channel because don't you want to have fun like this every day? Okay. Subscribe to our channel, and then right beside of that there's a little tiny bell and it goes ding 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 ding. Click on that because it gives you notifications every single time we post a video, and we've been going live a lot recently, so hello, you want notifications when we go live because there might be something special going on and you might miss it. So click that bell, make sure that you do that.
Next week's video is going to be about our favorite snacks. Whoa, I'm so excited for that. So look out for that. It'll be exactly a week from today.
Bye, friends. So I wanted to talk about, why is my dog always barking? She's just always barking.